Today, I want to talk about omega-3s. I have gotten this question a lot recently about should I get my omega-3s tested? So today, I want to talk through what are the pros, the cons, and general dietary guidance around omega-3s. So first, let's talk about what are they? Omega-3s are fatty acids, and there are a variety of different types of omega-3s that we can get through the diet. If you go buy fish oil or omega-3 pills and you look at the nutrition facts on the back, oftentimes it'll have a milligram amount listed for total omega-3s, but then it'll also split out and tell you specifically what types of omega-3s are making up that total amount. Oh, I have a cat behind me. Um, when we look at the different types that are present, you'll typically see ALA, EPA, and DHA as the three that are listed. So ALA is the plant-based form of omega-3 fatty acids, and we typically get these from flax seeds, chia seeds, and walnuts. You'll also see EPA and DHA, which are both marine-based types of omega-3s. So we typically get these from algae and different fatty fish. So things like salmon, tuna, and mackerel are some of the most common sources that we'll find these in. Omega-3s are important because they help with cell membrane structure. They also have a lot of anti-inflammatory properties. So if you have been told that you need to take omega-3s in your diet, it was likely because of something going on with your cells or looking for some anti-inflammatory properties. There's also evidence showing that omega-3s can support heart health, brain function, eye health, and overall well-being. They do play a role in reducing risk of chronic diseases and inflammation. So like I mentioned, they have these anti-inflammatory properties that can help with reducing overall inflammation. And because they are helpful with cell membrane structure, this is what can really help with things like brain function and eye health. When we talk about blood testing for omega-3s, this test typically measures the omega-3 index, which is the percentage of EPA and DHA that are found in red blood cell membranes. Other tests may measure individual fatty acid levels, so they may measure EPA, DHA, ALA, or ratios, so you could get your omega-6 to your omega-3 ratio from some of those tests. Typically, these tests are a simple blood draw. So if you prick your finger, get a dot on the testing paper or whatever it is that they're using as their collection device, that can be enough. Or they can also test this through venous blood. So if you're already getting a blood draw for other, like maybe it's your standard CBC panel, we can also test for omega-3s through that as well. Typically, these results are available within a few days or a few weeks. So the pros, what is the benefit of getting your omega-3 blood work tested? So one pro is that you get a personalized assessment. So this can help with providing an objective measure of your current omega-3 status, which can vary widely among individuals due to your diet, genetic factors, and your lifestyle. Getting this test can also help with moving beyond general dietary recommendations and get more into your specific needs. So, as a dietitian, if I have someone who is getting their omega-3s tested, I can now give more specific advice towards either omega-3 supplementation or changing dietary behaviors around eating some of those dietary sources of omega-3s rather than just giving blanket recommendations. This can also help with your overall health risk assessment. So, a low omega-3 index is associated with an increased risk of cardiovascular disease, cognitive decline, and other inflammatory conditions. So, if we know your omega-3 status, we can also better assess what your risk is for some of these conditions. And this can serve as an early indicator for some potential health issues that might pop up down the road. So, especially if these are things that run in your family and you maybe have a genetic predisposition, struggling with words, genetic predisposition to that, this could be a great test for you to take to help with being an early indicator of if this is something that might pop up. As I mentioned before, having this tested can also guide supplementation. So if we have this tested, we can determine if omega-3 supplementation is necessary, and if so, what dosage would be appropriate. Oftentimes, if we don't have this test, we'll take more of like a shotgun approach and we'll just supplement because it might be beneficial and there's not a lot of negative associated with it. But if we know your actual omega-3 levels, that can be really helpful with making sure that we are supplementing appropriately. This can also help with monitoring dietary changes. So if we do multiple tests over time, that would allow you to track the effectiveness of dietary interventions or supplements over time and provide tangible feedback on whether your efforts are improving your omega-3 status or if further change is needed. All right, so we've discussed that there are a lot of a lot of pros associated with omega-3 supplementation, and that can, really direct how we manage your diet, how we manage supplementation, and assessing some of those health risk factors. So let's talk about some of the cons. One of the big cons is cost. Omega-3 blood tests can be somewhat expensive and they are often not covered by insurance. So if cost is something that you are concerned about, this could be a real barrier to having your omega-3s tested. Interpretation complexity can also be a barrier. Optimal ranges can vary slightly between which lab is being used. So we do have omega-3 testing available here at eNRG Performance, and we are very familiar with those ranges that lab is using. So just make sure that whoever you are working with knows what lab you are using and what testing procedure is being done, because that can definitely vary the interpretation of those results and how that is looked at by your healthcare provider. Another thing to keep in mind is that if you're only doing this once, you're only getting a single snapshot. So you get a single test that provides a snapshot in time of your omega-3 levels at that point in time. But as I mentioned, with dietary changes and with supplementation, this can fluctuate over time. So regular testing might be needed to truly monitor this and pay attention to long-term trends, which unfortunately will add to the cost. The other thing to keep in mind is that while omega-3s are important, this test only focuses on the omega-3 nutrient. We're not getting like that total CBC blood panel where we can look at a variety of things. We're just getting omega-3s. So it's important to keep in mind that while this is an important piece of our health, this is not the full story, and it's important to still look at those other factors. Okay, so pros, cons. Let's assume that this is something you're still really interested in and want to know what those omega-3 levels are. You have the money to pay for it. What does this actually mean and how do we interpret these results? So when we're looking at omega-3 indexes, typically we want your index to be 8% or higher. This is associated with the lowest risk of cardiovascular events. The intermediate range is anywhere between 4 to 8%, and this indicates that you definitely need to increase your intake of omega-3s. Anything below a 4 indicates that you have a significant deficiency and you're at higher risk for specific health events like what I had listed before. So if you get these results back and it's not in the desirable range you would like to be in, there are still things that we can do to fix this. So like I mentioned, fatty fish is one of the main sources of omega-3s. So if you can aim for 2 to 3 servings per week of salmon, mackerel, sardines, anchovies, or herring, those are going to be some of your best sources for omega-3s in the diet. You can focus on smaller fish to minimize your mercury exposure. So like I mentioned, tuna is still a good source of omega-3s, but that's a pretty big fish. So if we're eating tuna 2 to 3 times a week, that does increase the risk for mercury exposure. So it doesn't mean you can't have tuna, but if we can focus more on some of these smaller fish, that can help with minimizing that risk. We can also incorporate more alpha-linoleic, ALA, plant foods. So adding things like flaxseed to smoothies or chia seeds to yogurt and granola, or even adding walnuts, hemp seeds, and flaxseed oil in our cooking can be some strategies for improving the plant-based omega-3s that we get. One note that I'd like to make here, though, is that ALA conversion to EPA and DHA isn't very efficient. So if we're going for those plant-based omega-3 sources, They're okay as a supplementary source, but they don't do great as our primary source because that conversion is not efficient. So it's okay to add chia seeds, but if we come back saying that we have a very low amount of omega-3s, we do need to add some of those fish sources to actually get it back up to a desirable range. You can also consider adding omega-3 supplements, so fish oil, krill oil, or algae oil. So especially if you're vegetarian or vegan and you're not going to eat fish sources, you can do plant-based oil and get that through supplementation. It's important to choose reputable brands that are third-party tested for purity and potency. And also make sure that when you flip it over and look at the back, that it does tell you that it has EPA and DHA specifically. If the back of that nutrition facts label or supplement facts label just says omega-3s, but it doesn't tell you that you're getting EPA or DHA, you might just be getting ALA, which, as we mentioned previously, does not convert well into EPA and DHA. So make sure the supplement that you choose is third-party tested and lists out that it does contain EPA and DHA. Like I mentioned, omega-3s are just a snapshot in time. So it's also important to retest and monitor. So if we are going to be doing a supplementation program, I recommend retesting about every 3 to 6 months when you're making those consistent dietary changes to make sure that they're actually being effective. If we retest in 3 to 6 months and you're back up in desirable ranges, that means that we can continue on that plan for a maintenance plan. If we retest in 3 to 6 months and you're still in the undesirable level, that means that we have some more work to do. So it is important to make sure that we are retesting with these things. I also want to note, so we've been talking about omega-3s, but another piece of the puzzle here is omega-6s. So like I mentioned, in the different types of tests that you can get done, there are some tests that will give you an omega-3 to an omega-6 ratio. Omega-6s are a different type of fatty acid. They're also essential, but when we consume these ones in excess, this can lead to an imbalance of omega-3s to omega-6s. And this is actually pretty common in the standard Western diet. If we can reduce consumption of things like highly processed foods, vegetable oils that are high in omega-6s, so things like corn, soybean, and sunflower oil, and fried foods, that can help with reducing the omega-6 to omega-3 ratio. And that can also help with improving your omega-3 score. So it's important to consider what other fats are interacting with the omega-3 fatty acids to make sure that we have an adequate amount in your diet. And then, as always, if you are doing one of these tests, or if you're concerned about your omega-3 intake and you're thinking to yourself, dang, she just talked a lot about fish and I hate fish. I don't think I've had a serving of fish in the last 3 years. I'm a little concerned that my omega-3s are low. This would be the time to consult with a professional. So if you are interested in getting tested, please reach out to one of us at eNRG Performance and we can help you with setting up that test and interpreting the results. It's not enough to just do the test and be like, oh, she said 8% is good, so I'm good. It's important to have a professional actually review and look at those results with you to make sure that they're being interpreted properly and that the course of action to fix a low amount of omega-3s is appropriate for you. So schedule a consult with a dietitian. I highly recommend it. And we can talk over any planned dietary changes or supplementation that might need to occur, and can also provide individualized advice to ensure that it aligns with your overall health goals and any pre-existing conditions that you might have, and also any medications that you might be taking. So kind of to sum this one up, omega-3 testing can be a valuable tool. This is something that I personally love to use, especially if I have clients who are concerned about certain things. It can help with understanding your nutritional status and with making targeted dietary adjustments instead of just doing like a shotgun supplement approach. There is a cost associated with this, as there is with anything in life, right? And there are a few complexities involved, but if you have the appropriate professionals on your team to help you with interpreting these results and making those changes after, I think that the cost often outweighs the risk of not doing it, because that cost investment is now helping you with understanding your health and what some of your risk factors are associated with your dietary habits and other lifestyle factors. So if you have more questions about omega-3s, you want to learn more about this topic, or you're interested in testing or getting test results interpreted, please don't hesitate to reach out. We are here to help you.